via the chat or just unmute and ask a question. I'm happy for anyone to to interrupt or have a ask anything as the meeting goes on. So just use, as I say, unmute. Put your hand up if you want as well, if that's you want to join in at any point, or as I say, just however you wish to join, you're more than welcome to. I'll just give it a minute before we start. Okay, so just a quick one then. I'll just take you through the data first of all, as people are still joining the meeting. So if I just share my screen, do shout if in a second you can't see my screen. So everyone should be able to see the presentation now.
Yeah, we can see it.
Do shout if you can't. That's great, thanks Jess. So at the minute, you can see that this is wave 3 that happens in mid-January, and all cases across Warwickshire are coming down to the point where now we have a daily average of about 16 cases across the county. And as you can see, there are high as like 300, 492 was our highest that we saw in one day as a daily average in Warwickshire. So we're down to about 16, which is brilliant. The area with the most numbers of cases is Nuneaton and Bedworth at 44, followed by Rugby, then Warwick, Stratford-upon-Avon and North Warwickshire. And our rate has massively come down. I mean, at one point we had, as we saw in one area, we had as many as like 200-300 cases. So this has massively come down. The 7-day rolling average rate, which is the number of cases by the population, in Warwick, we've got 24.2 per 100,000 people as a 7-day rolling average, which is slightly higher than England, slightly higher than Coventry, and a bit higher than Solihull. But as you can see, it's great to see that across all of our areas, we're now at, under 50 cases per day as a daily average, which is brilliant, which is absolutely brilliant. Brilliant to see that we're under 50 cases in the last 7 days. So this is, a lot lower than where we're at, so we're doing a lot more testing. For the whole of Warwickshire, we've seen 140 cases, which is at one point we were seeing that many cases in just a ward. So it's brilliant to see that the cases have come down. So what does this mean for you guys in early year settings? So ultimately, at the minute, we've got 2 dates coming up in which guidance is changing. There's the 17th of May and then the 21st of June. So on the 17th of May, you can have, at the minute, you can only have 2 households outside, but from the 17th of May, you can have up to 30 people outside, and inside you can have 2 households or 6 people from different households who can be close contacts of each other. That's from the 17th of May. From the 21st of June, for all areas from festivals, nightclubs, you name it, there appears to be sort of a lack of guidance and no need to be doing lots of the COVID measures that we've been doing to date. So you can openly mix, you can openly attend things, and it appears to be life is going back to a lot more of the normality. So at the minute we've got from the 17th of May, we've still got sort of the limited mixing, but from the 21st of June, we've got a lot more mixing from then. And the biggest mix up really is obviously outside, where you can have up to 30 people, which is brilliant. For us though, obviously the main thing that we need to focus on going forward is just getting across the line and keep everything, keeping things clean, reducing our interactions, trying to keep our groupings or bubble sizes as small as we possibly can. Even though we're seeing less cases, we still need to kind of keep going until sort of we release off around a lot of the guidance. And it might feel quite exhausting to keep doing your 2 tests a week, but the further we stamp it out, the more we bring it down, the better. The biggest piece of work that's going to be happening soon is variants, if we have any variants in the area. So this could be like a Brazilian, an Indian, or Nigerian, South African. So we have had, as international travelling is opening on the 17th of May, we're having people who are going to different countries. Now, obviously, we've got the green countries, amber countries, and red countries. On the Warwickshire website, there's a tile which will say summer, and if you want to go onto the summer tile, you can find any advice and guidance that you want on international travel and the rules. But ultimately, a quick summary is that if you're going to a green country, you need to test on the way back, and it needs to be negative. If you're going to an amber or a red country, an amber country, you need to isolate for 10 days and test on two of those days, on day 2 and day 8. If you're coming back from a red country, it is likely you'll need to go to a quarantine hotel and remain in a quarantine hotel. So the closest country to us on the green list is Portugal. There's not many European countries on the list for green. Most are in the amber areas like Greece, Spain, France are on the amber list, where you have to come home and isolate for 10 days and test twice. And then other countries like Turkey, India are on the red list. We do, even though we're following up with Border Force, we are having quite a few people. So we've got 2 people so far who've reported to us saying that they've had the wrong guidance and they've tried to get their children into school, even though they've come back from a red country. So it's just bearing in mind what the guidance is, and if you're aware of any families who are travelling internationally, that you are aware so they don't accidentally prematurely bring their children into your setting. So it's just being wary of that. We are still doing the LFT testing and we're still doing the PCR testing. PCR is mostly for if you've got the top 3 symptoms, but if you've got any lesser symptoms and there are cases in your area, or if you're aware of any outbreaks, then we will keep to PCRing for the lesser symptoms. But if you don't have any cases in your settings and haven't known of any local outbreaks, then you can now move from PCRing so that you don't have to PCR everyone with lesser symptoms. You can now only request that if they've got the top 3 symptoms. So just cover that again. We are knowing of cases reducing. I have shared with you before that if they've got lesser symptoms, like if they've got a sore throat, feeling really unwell in themselves, and muscle aches, fatigue, that we would recommend that they PCR. Now what we're saying is that if they want to go in PCR, that's absolutely fine, but unless there's cases in your setting or you're aware of any outbreaks locally, we are not now demanding people with the lesser symptoms to PCR. So you don't have to do that every single time, but if people want to go, then they can and go and get PCR testing. LFT testing for your staff is still recommended until we're being told that the measures can pull away. So that's twice a week LFT testing, and that will keep going for the, until we're informed that it can stop. If we are aware of any variants that could be in, if you have any positives in your setting, and then we find out, it's usually about 10, 12 days later, we find out they're linked to a variant, we will be in contact with you and we'll be working with you to understand some of the transmission on site. So do expect us to be supporting you. If you are aware of a variant at your site and you're not working with us, then please do contact us and we can support you and advise you through that period. We haven't had any variants connected to any nursery settings as of yet, but if that does happen, please come to us for support and help via the Early Years Advisors email address. So we've at the minute, as I say, cases are coming down, which is great news. And the guidance is mostly on the date of the 17th of May and the 21st of June. We just to let you know as well that we are aware of 2 settings that have recently had a large number. Each of them have had about 18 children. So 2 settings with 18 children who've had have been really unwell with respiratory syndrome, like some kind of respiratory illness. If any of you are also experiencing that in your setting, please let me know, because we are just sending out some experts to do some testing on a couple of those kids at each setting, just to double check that it's definitely just a common cold, because it may be the fact that these children have been quite sheltered and not had the normal illnesses that they're being exposed to, and now we're opening up again. There's a lot more illnesses circulating, so they're picking up a lot more common colds. That may be it, but we're double checking it, so I'm getting some tests done. So if any of you have also experienced a large number of children who appear to be unwell and it moving through your setting, then please do let me know. So that covers the main things and the 2 dates about international travel, about LFT testing, keep going, keep doing the staff testing, and that if any children have the lesser symptoms, unless you've got any outbreaks in your area, or unless you've got children in your setting who have, been a case, which I don't think there are any nurseries at the minute with cases, then you can move away from asking all families to PCR. It's more likely now to be a cold. But if you do have any cases in any feeder schools or any cases in your site, then obviously we would want them to PCR if they're unwell. That doesn't change the national guidance. If you have the top 3 symptoms, which is the cough, the high temperature, the loss or change of sense of smell, you must, on those legally, you must go and get a test. That's all for the updates I've got for today. Is there any questions or queries from anybody from the chat, or just unmute yourself and I can pick up any questions or queries. I always hate it when it's quiet because it freaks me out a little bit. I'm like, oh, have I just rattled at you and you don't know what I've said? Great. Okay, there doesn't appear to be anything. Can we have assemblies? So right now, the guidance up until the 21st of June is up until the 21st of June is we're having 2 households indoors or groups of 6. So unless they're in a bubble group, then we would want to have them. We wouldn't want them together quite yet. We want to keep bringing the figures down as much as we can. So ideally not mixing bubbles and assemblies. We have had situations whereby we've had an assembly or we've had a staff in a meeting room. They have been 2 meters apart, but it has spread from one person to the other, even though they've had the windows open, face coverings on, and they've kept the 2 meters apart. So there has been spread, and that's been the only time in which they've been together. So I would suggest that actually at the minute it's probably it's probably very low risk to have an assembly, but just if we can just get to the 21st of June, hopefully so the figures will come down even further to the point where we've got hardly any and we can resume back to some of that mixing. Because at the minute, my fear would be the minute you have an assembly will be the one time that you have a case in your setting, and will be the one time it spreads between years as a result. So just till we get to this next phase, I'd say no. Same around bubbles. From the 21st of June, there appears to be absolutely an absence of any COVID measures. So until we get any further guidance, bubbles will remain in place until the 21st of June. The reason being, from the 17th of May, you're allowed 30 outside and only 2 inside, 2 households together inside, or 6 separate households, 6 people from different households together. So they're limiting still the amount of spread. So my fear would be that if we start to switch on our earlier settings, that could create more spread just as we're getting we're purging the last bits out. Would we be able to have parents' events, graduation ceremonies after 21st of June? Yes. So at the moment, festivals are on, concerts are on, nightclubs are opening, you name it, it's all, it's all back on. So I would say from the 21st of June, you can go back to having your, your graduations of your kids. If you're doing anything at the minute, you can have it outside. So you can have up to 30 outside from the 17th of May. So if you want to have any outside events, you can. So with the good weather coming as well, if you want to have a graduation outside, then you can have them distanced and have up to 30 outside. It's just obviously just trying to do the measures as much as you can. It's just not inside at this time. And new children site for induction visits. So if you need to have new children site, that's part of like the working guidance of how you would run. So what you would do is keep a track of who the children are, who they've mixed with and the bubble, and just inform any new children who've come to do an induction day that if they have tested positive, developed symptoms within the 48 hours of leaving your setting, that they let you know. So so you can have new children on site. You can have parents do a visiting at distance on site, so they come through with a distance. You track it, obviously. I'd imagine children will be in the setting at that time, and it's again just saying to them, if they're coming to visit you, to make sure that if they are close contact of someone showing them around, that they let you know if they've been unwell or tested positive after they've left the site. So it's having some of those rules around being informed. We have had parents in schools that haven't let schools know of positives, so it's just being really strict with them to say you really need to let us know. And when they're visiting, wearing a face covering, and your staff staying 2 meters away from them as much as possible. But some of those things can start up again, but obviously, keeping a distance as much as possible. Would this be without face masks and social distancing? So from the 21st of June, it appears that face coverings and social distancing will be going, because there's no guidance on what that will be or where that's needed. I don't see how you can run a nightclub or a festival with social distancing and face coverings, but that's my view, is that we're looking at from the 21st of June, a lot of those control measures will come off. Would deep cleaning at the end of each day come to an end after 21st? I would imagine, obviously, for all infection prevention, like colds, and any coughs and sniffles, you would still clean, but code cleaning, as it has been, will, I would see, come to an end from the 21st of June as well. We just need to get through this last bit, just get below a certain number, and then basically all we'll be doing is like contact tracing, any small outbreaks from then. But hopefully we'll come down to a figure whereby a lot of this isn't needed. But yes, from the I'm seeing that there's the absence of any control measures written in the guidance for the 21st of June will suggest that a lot of these measures will be removed from the 21st of June. So just keep them going. You've got 6 weeks to go. Just keep going, last push, and then hopefully we'll have a more open summer. I'm really appreciating these questions, guys. It's great to know that that I'm helping provide advice and guidance, and that there are questions out there. Hopefully that all makes sense. Any more questions? It's been great that we've had many thanks. Okay, great. So what we'll do is we'll arrange another one, I think, in a couple of weeks, and then we'll see how we go from there. But hopefully, because that will be after the 17th of May, and we'll keep you up to date with everything that's going on. But I don't think there's anything more to share with you guys. I'm really glad to say that there are hardly any cases of nurseries coming up at the minute. So so it's been brilliant to see that, and long may it last, definitely. So thank you all, and have a great rest of your Tuesday.